I'm Rubing Bank, Channel 7 News, and today we're investigating the HIV epidemic in South Africa. We're going to talk to Sasha, one of the leading organizations helping to combat the spread of this disease. I'm here with the executive board of the South Africa Sustainable Health Association. Why don't you introduce yourselves and explain your role with the organization?
So my name is Buckley Sake, and I'm the research specialist of the organization.
My name is Harini Patabelli, and I'm the Director of Outreach.
My name is Danny Wang. I'm the Community Support Facilitator.
So Harini, why don't you tell me a little bit more about the country that Sasha primarily works in?
Yeah, so South Africa is a multiracial and diverse country. Fortunately, South Africa has a pressing issue of HIV/AIDS and even has the highest number of people living with HIV/AIDS in the world, with a staggering number of about 7,200,000.
How would you describe your organization's main mission?
Well, we're dedicated to reducing transmission rates of HIV/AIDS, and we want to promise to improve the health and well-being of all South Africans through HIV treatment and prevention now and for future generations.
How does Sasha envision accomplishing this mission?
We want to increase the quality of life of South Africans by implementing sustainable public health solutions such as sexual education and increased access to contraceptives that reduce HIV transmission rates in the next decade.
Buckley, could you please provide us with some background on the current state of health in South Africa?
Globally speaking, is below average. Most prevalent disease is HIV.
So tell me, Buckley, how have HIV rates in South Africa changed recently?
Between 2010 and 2017, there's been a 30% decrease of the virus between people ages 15 to 49. In 2017, a 1% increase in the virus in terms of newly affected people.
So Danny, one of Sasha's main goals is to increase access to sexual health and education services to the majority of South Africans. What's a potential risk that you might encounter?
Okay, so a big risk is like failing to reach a significant percent of the population. So our mitigation for that is we will initialize the education program at the middle school level.
What are some indicators of success?
An indicator of success would include rising the percentage of HIV-infected South Africans that are aware of their infection from 90% to 95%. And another indicator of success would be implement a program that reach to 50% of more South Africans under the age of 18.
Another one of Sasha's objectives is to increase access to medication to prevent people who have HIV in South Africa from developing the disease AIDS. Do you see any risks involved in this objective as well, and how would you mitigate those risks?
Providing access to such medication on a large scale would be extremely expensive. However, one way to mitigate this potential risk would be to establish extensive funding, partnerships with NGOs and nonprofits that would help cover the cost of medication.
How would you measure the success of your medication objective?
An outcome indicator that would measure the success of this program would be the rate of AIDS development among HIV-positive South Africans. As of 2017, 61% of South Africans with HIV were receiving some form of treatment, and we would like to raise that to about 80%.
Another one of Sasha's objectives is to increase access to contraceptives, starting at the middle school level, to stem rates of HIV increase in future generations. Do you and Sasha foresee any risks happening with this objective as well, and how would you mitigate those?
Contraceptive provided by our clinic will be free. Low-income individuals may still incur costs such as transportation to clinics providing the contraceptive and the management of side effects that may result from contraceptive use. Mitigate this by establishing clinic in a variety of locations so individuals will not have to travel far to receive them, and by providing funding for basic medical care to treat side effects of the contraceptive.
Does your organization, Sasha, have any indicators of the success of this contraceptive program?
As of 2007, there are about 52% of sexually active women report using contraceptives. We'd like to increase the rate of contraceptive use to about 65%.
So Danny, tell me about the timeline that your organization is using.
First of all, we will raise the percentage of HIV-infected South Africans that are aware of their infection from 90% to 95%. And secondly, we will increase the rate of contraceptive youths beginning at the middle school level from 52% to 65%. And finally, we will provide access to medication to HIV positive South Africans to increase the rate of South Africans with HIV that receive some form of treatment from 61% to 80%. So all these three objectives done by 2025.
So Buckley, I just talked with board member Danny about your organization's timeline for achieving its objectives. How do you plan on achieving them in such a narrow timeline?
We already know what to do in terms of tackling, HIV and the virus. We're talking mobility, mobilizing our cause. A lot of that is money. Our goal is to just partner up with various organizations who have this similar cause of mitigating the virus.
I would like to thank our 3 board members here for participating in this interview. And hopefully you will achieve the work that you're attempting to accomplish by 2025.